24-year-old male with history of depression and drug and alcohol abuse, is brought to the ED with altered mental status, diaphoresis, and agitation. When patient was placed on monitoring, his heart rate was 120, BP 195/89 with a MAP of 112, respirations 25, and temperature was 39. The patient is accompanied by his father, who tells the provider that he found his son like this and thinks he is taking drugs again.
Okay, I'm the provider. What brought you in today? Why is he so agitated? Did he take some drugs?
I'm not sure. I saw him taking some powder thing.
Is it the first time or he has been taking the drugs?
He's been drinking lately, but this is the first time I'm seeing him taking that powder.
NP examines the patient and notes clonus, that is involuntary and rhythmic muscle contractions, diaphoresis, tachycardia, hypertension, tachypnea, and hyperthermia. A while after the patient begins to seize, the provider orders lorazepam 2 mg IM in response to the seizure.
Medication. Okay, he's going to calm down now. We have to give him some oxygen and then we have to take some laps. Don't worry, okay? Thank you.
The attending and NP discuss the symptoms. The patient is on Prozac as per chart. Urine is positive for cocaine. WBC is 16,000, and the patient had a seizure and fevers. With these symptoms, history, and patient's positive response to the benzodiazepine given, the NP makes a diagnosis of serotonin syndrome.
Doctor, what is serotonin syndrome?
A potentially life-threatening drug reaction to certain medications that increase serotonin levels. Medication that cause overactivation of serotonin receptors may induce serotonin syndrome.
Examples of agents that can cause serotonin syndrome are agents that increase serotonin formation, such as oxytryptin, agents that increase release of serotonin, such as amphetamines, agents that can impair serotonin reuptake, like cocaine, tramadol, SSRIs, SNRIs, cyclic antidepressants, St. John's worts, agents that inhibit serotonin metabolism, such as MAO inhibitors. An example can be linezolid. Agents that direct serotonin reuptake agonists, such as fentanyl, and agents that increase sensitivity of postsynaptic serotonin receptors, which is lithium. Symptoms of serotonin syndrome include change in mental status, such as anxiety, restlessness, disorientation, and agitation, autonomic hyperactivity, such as diaphoresis, tachycardia, hyperthermia, hypertension, vomiting, and diarrhea. Neuromuscular hyperactivity, such as tremors, myoclonus, hyperreflexia, and bilateral Babinski sign.
Diagnosis of serotonin syndrome. Serotonin syndrome is usually diagnosed using the Hunter toxicity criteria. According to the Hunter criteria, a patient must have the presence of serotogenic agent and meet one of the following conditions: spontaneous clonus, indecible clonus and agitation or diaphoresis, ocular clonus and agitation or diaphoresis, tremor and hyperreflexia, hypertonia, temperature above 38 degrees Celsius, and ocular clonus or indecible clonus.
The treatment for serotonin syndrome is to first discontinue all serotonergic agents, followed by supportive care to normalize vital signs such as oxygen and IV fluids. If the patient is agitated, benzodiazepines can be given to sedate. Serotonin syndrome often resolves within 24 hours of discontinuing serotonergic agents. If benzodiazepines and supportive care fail to improve agitation and correct vital signs, we can administer cyproheptadine, which is considered the antidote for serotonin syndrome. Cyproheptadine has an initial dose of 12 milligrams, followed by 2 milligrams every 2 hours until clinical response is seen.